So the next thing we're going to do is a questionnaire to see how your memory's doing. And some questions are easier than others, so bear with me because it's all part of the same form, all right? The first question is, can you tell me what year it is?
Oh, the year is I know, but I can't say it. I can't see it. I can't do it right now.
It won't come out. Would it help to write it?
Let me see if my cap will work.
Okay.
I know it's 90 something.
Okay.
90. '98, 7. 97.
Okay. Do you know what season it is outside?
This is supposed to be spring, isn't it?
It is supposed to be spring. Doesn't always feel like it. Do you know what month it is?
This is April.
That's right. Do you know what date in April?
This is the 13th.
The 13th. And what day of the week is it?
This is Tuesday.
Tuesday. Now, what city are we in?
St. Louis City,
All right. And what state?
Missouri.
All right. And where are we right now in this room? Do you know what building we're in?
No, I'm not sure about the building.
Okay. Do you know where the building is? Or what it's a part of?
I know it's part of St. Louis University.
Right, right. And do you know what floor we're on?
We're on the second floor.
Second floor. There you go. All right. I'm going to say 3 words and ask you to repeat them and then see if you can remember them in a minute. Okay? The 3 words are ball, flag, and tree.
Ball, flag, and tree.
Good. Now, can you spell the word world?
World. W-O-U-L-D.
Can you spell that backwards? You want to try?
D. W. O. U. L. D.
There you go. Okay. Now, this is a tough one. Do you remember any of the 3 words from before?
I think you asked me about where am I? And this is at St. Louis University.
That's right.
I got that much. But the other I can't remember.
Yeah. Do you want me to tell you the first one?
Please do.
Ball.
Ball. B-A-L-L. Ball.
Does that ring a bell?
Ball. I don't remember the other.
Okay. Do you want me to tell you what they were or forget it? Okay. Ball, flag, and tree.
Ball, flag, and treat.
Did it ring a bell once I said it?
You would have just escaped through the brain before.
Well, let's try this. What's the name of this that I have on my hand?
A wedding ring.
Okay. And what's the name of this on my face?
Your eye glasses.
Good. All right. Can you say no ifs, ands, or buts?
No if, ands, and but.
Good. Now, I'm going to ask you to do 3 things in a row. Can you raise your hand, wave at me, and touch your knee?
Which hand? Any hand?
Your right hand.
Okay, the hand is raised, and you said touch your knee.
And wave at me, and then touch your knee. There you go. All right.
Close your eyes.
Well, look at you. You knew what to do right away. And can you see this picture here?
This.
Can you take this pen and try to copy it? There you go. That's a good one. Now, the last thing we're going to do is I'm going to read you a little story. And I want you to pretend that this story is about you, that you're in the situation. And then I'm going to ask you some questions about the story to see what your answers would be. Okay? And what this helps me do is see how you think through medical questions or medical issues if you were to have to make a decision about your medical care.
Oh.
Okay? So here's the story. You are in a nursing home. Over the past few years, you have become forgetful and occasionally confused. You have Alzheimer's disease. You are able to recognize relatives and nursing home staff. You are in good physical health. You seem happy and contented. However, your memory problems are going to get worse. One day, you pass some blood from your bowel. You can leave it and not have any tests, or your doctor can organize for you to have some tests to see where the bleeding is coming from, followed by surgery if a cancer is found. Okay, so that's the little story. And the first thing I want to ask you is, can you tell me what the story was about?
About cancer?
And what about it?
If I were bleeding, you know, and if I were bleeding, and I could, if I was bleeding from cancer, then I could tell you what it was about, right?
Okay, okay. Now, in the story, they give a couple of options for treatment. Okay. Do you have any thoughts about what treatment you would want if you had this situation?
Would I have a choice?
You would. In the story, it says you can either leave it and not have any tests, or you could have a test to see where the bleeding is coming from.
I would rather have The test.
You would have the test, okay. Can you name what another option would be besides having the test?
If I leave it go, it would, I don't know, it might, kill me.
Uh-huh, right. So, what are the reasons that you would want the test?
Because I want to know what's going on.
Okay. Can you think of a problem that might come from that choice of getting the test done?
Sometimes you still may die from it.
It might not save you, is what you're
Right.
saying? Okay. What do you think the choice to have the test would mean for you or your family? What effect might it have on you?
I don't know, I might be sad,
Why would you be sad?
Well, nobody wants to really die. I mean, I don't.
Right, okay. What about your family? What decision do you think or what effect do you think the decision would have on your family?
Now that I can't answer.
Okay. Why is it hard to answer?
Because I don't know what they would think or what.
Okay. Can you think of a short-term effect that the treatment might have of having the test?
I don't have a clue on that.
Okay. Can you think of something in the long run that having the test could affect you?
It might could save me, and then it could not.
Right, okay. So can you repeat again what the treatment is that you would choose?
The cancer. No, what? I can't remember all of that.
Okay. Yeah, in the story it gave two options for treatment, and you had chosen one path to take. Do you remember what path that was?
To have the test done.
To have the test done, that's right. So it sounds like, from what we've done here, that when a medical situation comes up, you're able to have an opinion about what you want done. Okay, all right. That's helpful, because some people have trouble making decisions like that. All right. The last thing I'm going to ask you is not related to what we just did. All right, it has to do with something called CPR. Do you know what that is?
CPR. Mm-hmm. That's I know what it is. CPR, I know what that is.
Would you like me to explain it?
CPR. Oh God, no. Yeah, do that. Just give me a hint.
Sure. CPR is if your heart stops beating and you stop breathing, CPR is used to try to revive a person.
Okay, and you do that mouth-to-mouth thing.
That's right.
Okay, that respiration, is that what it's called? Respiration?
Yeah, they do chest compressions to try to keep your blood flowing through your body.
Oh, okay.
And they do that respirations to keep oxygen flowing, okay? CPR is used when somebody dies. to try to keep their brain and their vital organs with enough oxygen so that there isn't too much damage before they can get to a hospital and try to be revived. So if you were to have your heart stop beating and you stopped breathing, would you want us to try to do CPR on you, or would you rather have us let you go?
Oh no, I want you to try to save me because I got to look good.
Okay. You have things that you still want to do in life, huh?
Yeah,
Okay.
I can't get around, but I can still see. Look.
Okay. All right. Well, that's good to know. So if you ever are in that situation, hopefully we won't have to come to it. But if we do, we'll know that you want us to do that. Okay. Mrs. H, I really appreciate your doing the interview today. I enjoyed talking with you.
Thank you.
Yeah.